Hello, welcome to my channel again, and today we're going to talk about multiple organ dysfunction syndrome. If you learned something, please put the thumbs up and like and share. Understanding multiple organ dysfunction syndrome is crucial for nursing students preparing for the NCLEX exam. Here's a summary of key concepts related to M.O.D.S that you should focus on to ensure you're well prepared. First of all, the definition. M.O.D.S is referred to as a progressive failure of two or more organ systems following an acute illness or injury. It occurs as a result of uncontrolled inflammatory response, typically after a severe insult, such as sepsis, trauma, or extensive surgery. The pathophysiology is the initial phase. The body's inflammatory response leads to the release of inflammatory mediators, cytokines, which can cause tissue damage. Organ dysfunction. As the inflammatory process continues, it can lead to hypoperfusion, insufficient oxygen delivery, and cellular injury, eventually resulting in multiple organ systems failing. Commonly affected organs. Commonly affected organs are respiratory system, in ARDS, acute respiratory distress syndrome, cardiovascular system, in shock and hypotension, the renal system, in acute renal failure, hepatic system, in elevated liver enzymes, and the central nervous system, in altered mental status. The causes and risk factors are most commonly due to sepsis from bacterial, viral, or fungal infections. The trauma from M.O.D.S is severe injuries leading to hemorrhagic shock. Pancreatitis, severe inflammation of the pancreas can lead to systemic inflammation. Clinical manifestations. The respiratory changes you'll see are tachypnea, hypoxemia, and respiratory failure signs. In the cardiovascular changes, you'll see tachycardia, hypotension, and decreased cardio output. In the renal changes, you'll see oliguria and anuria, elevated serum creatinine and BUN. Neurological changes, you'll see confusion, lethargy, or coma due to altered perfusion. Coagulation changes, you'll see potential for disseminated intravascular coagulation, DIC, which is essentially you clotting and bleeding at the same time. Diagnosis and laboratory tests: obtain comprehensive metabolic panel, liver function tests, complete blood count, blood cultures, and lactic acid levels. Imaging, you may want to include a chest x-ray or ultrasound to evaluate organ systems, monitor organ function, regular assessment of vital signs, urine output, and neurological status. Management and nursing interventions. For supportive care, you want to focus on stabilization of vital signs and supporting failing organs. Fluid resuscitation, you want to administer IV fluids judiciously to improve perfusion and reduce hypovolemic shock. In terms of medication, you're going to want to administer vasopressors like norepinephrine for hypotension and antibiotics if sepsis is suspected. In terms of nutritional support, early enteral feeding may be indicated to support metabolism and gut integrity. Continuous monitoring. You must continuously monitor and keep close eye on vital sign monitoring, labs, and assessments of organ functions. For prevention, identify at-risk persons, those with severe infections, trauma, or history of chronic illnesses. Infection control. Implement strict infection control protocols to prevent sepsis. Early intervention. Optimize care for patients showing signs of deterioration to prevent the progression of M.O.D.S. Nursing consideration. mods. In terms of education, you want to teach about the importance of early recognition and reporting of changes in patient status. For family support, you want to provide emotional support and updates to families, especially considering that the seriousness of the nature of M.O.D.S. Interdisciplinary collaboration, emphasize cooperation with the healthcare team in managing complex cases and maximizing care. In terms of NCLEX tips for M.O.D.S, familiarize yourself with case studies involving M.O.D.S. Practice interpreting lab values related to organ dysfunction and review questions highlighting clinical scenarios associated with sepsis, trauma resulting in M.O.D.S. And understand how to prioritize care interventions of patients at risk of experiencing M.O.D.S. Understand that the prognosis is very poor for the late stages of M.O.D.S. Becoming well acquainted with these concepts, you'll be well prepared to answer the NCLEX questions related to multiple organ dysfunction syndrome and provide safe, effective patient care. And good luck with your studies. If you learned something today, please like and share and place your questions in the comments.